Hi there. Today I'm going to explain to you what an ERCP is, why we might be doing it, what the risks are, and how you might prepare for the procedure. So an ERCP is an endoscopic procedure typically to remove bile duct stones or stent an obstruction of the bile duct due to a pancreatic cancer or a cholangiocarcinoma.
The endoscopist passes a thin, flexible tube with a camera at the end through the mouth, down the food pipe, past the stomach to the small bowel, where the bile duct drains into the duodenum. From that point, instruments are inserted up the bile duct to accomplish the aims of the procedure. The procedure normally takes around 45 minutes and is typically performed under sedation, which means that patients are drowsy and relaxed but aware of the procedure being involved. I'm now going to tell you about the risks. The risks of the procedure can be as high as 5% and include pancreatitis, bleeding, perforation, and cholangitis, which means infection of the bile duct. Life-threatening complications can occur between 1 and 700 cases. A doctor will only perform the procedure if the benefits outweigh the risks. A diclofenac suppository is inserted into the patient's bottom prior to the procedure being performed in order to reduce the risks of pancreatitis. Around half of ERCPs involve placing a stent, which can either be plastic or metallic, in the bile duct in order to allow its drainage. This may need to be removed a few months afterwards via another ERCP. A stent will only be placed if your endoscopist thinks that you will benefit from it. It takes around 20 to 30 minutes to feel fully awake after the procedure. Patients are monitored for between 2 and 4 hours after whilst in recovery, because we know that this is the time period during which most complications can arise. We would ask that you have a chaperone take you home and observe you overnight to ensure you remain well. In most cases, you are able to return to your normal daily duties the next day. The pre-assessment nurse will now ask you to sign the first stage of consent. This does not hold you to having the procedure. What it does is confirm that we have given you enough time to think about whether you want the procedure now you know the risks. On the day of the procedure, you will have a chance to discuss more with the endoscopist performing your ERCP, and to go ahead, you will be asked to sign again in order to confirm your consent. The pre-assessment nurse will also ask you to have some blood tests to check that they are within normal limits for the procedure to occur safely.